Okay, Assalamualaikum dear students. So in this video, I will continue with lecture Circulatory Disturbances Part 2. So I would like to say I am sorry again. I cannot be physically attended in the classroom. Okay, as however from this video and from the lecture slides that I've given you, you can actually look at the slides and also follow the video that I'm sending to you guys. So in this second part for the circulatory disturbances, there's another for pathological disease that you should know, which is infarction, shock, gangrene, and also edema. Okay, and I think some of the topics are already known to you. I mean, maybe gangrene and edema would be something common that you guys would already know about. But we will go into that topic after this. Okay. Okay, so first I will continue with infarction. So what is actually infarction? So infarction is the development of an area of localized necrosis in a tissue because of sudden reduction of its blood supply. Okay, so it means that there's necrosis, okay, going on in the tissue because what? Because why? Because there's a reduction in the blood supply. And both parenchymal cells and also interstitial tissue undergo necrosis. Now, infarction, it is most commonly due to what? Due to arterial obstruction, either by thrombosis or embolism. It's very, very rarely caused by the obstruction of the venous drainage. Yeah. So in this slide, there's a picture, example of a myocardial infarction, which occurs in the heart. Okay, so there's the anterior wall infarction, and we could see that in the picture there's a red thrombus. Okay, it means there's atherosclerotic plaque going on, and then there's red thrombus on the ruptured atherosclerotic plaque, which causes the blockage of the blood flow, and then it leads to infarction, which is called the myocardial infarction. So classification of infarcts goes on the it means that the appearance of an infarct, it varies with the site. So there are various classification schemes that are used, and there are three types, which is the pale versus red, solid versus liquefied, and also sterile versus septic. So we see pale versus red. Pale, when we hear pale, we think of something that looks white. I mean, you know, pale. So pale infarcts are white and anemic infarcts. Okay, and they occur as a result of the arterial obstruction in solid organs such as the heart, kidney, spleen, and also brain that lack the significant collateral circulation. Okay, so in this picture there's a acute renal infarction. So we could see there's a white colored area, and that's what we call as the pale infarct. I mean that white colored area is the pale infarct. I mean and it occurs as a result of the arterial obstruction. So that's pale. How about red? What is red infarcts? Or we call it as hemorrhagic infarcts. Now, red infarcts, they are found in tissues that have double supply, such as the lung or liver, or in tissues such as intestine that have collateral vessels permitting some continued flow into the area. Now, why the infarct is red? Because of extravasation of blood in the infarcted area from necrotic small vessels. Now, red infarcts, they also occur in tissue. If there's dissolution or fragmentation of the occluding thrombus, which permits to the re-establishment of arterial flow to the infarcted area. And venous infarcts are also associated with hemorrhage, and also congestion. So these are called red infarcts, okay, and they are in red color. That's why we call red infarcts, okay. It's because there's the extravasation of blood at the infarcted area, okay, from necrotic small vessels, okay. So we call red infarct. There's also solid versus liquefied. There's also the solid infarct and the liquefied infarcts. So what are solid infarcts? Solid infarcts, it occurs in all tissues other than the brain, okay. And infarction actually produces coagulative necrosis of cells. So coagulated means that they are solid infarcts. And there's also liquefied infarcts, which happens in the brain. So solid happens in all tissues except the brain. Then there's liquefied infarcts, which happens in the brain. And this liquefactive necrosis of cells, it leads to formation of the fluid mass. And the end result is a cystic cavity. So you can see in this picture, it's a liquefactive necrosis. So it means that there's infarct of the brain showing dissolution of tissue here. Solid versus liquefied. Another one is the sterile versus septic. Now, most infarcts, they are sterile. Sterile means, okay. And septic infarcts, it means that they are characterized by a secondary bacterial infection of the necrotic tissue. Now, septic infarcts, it occur when there's microorganism present in the thrombus or embolus. Okay, so for example, there's an emboli in infective endocarditis, or infarction occurs in a tissue, example intestine, that normally contains bacteria, or bacteria from the bloodstream that causes the secondary infection. However, this is unusual because blood is normally sterile. Okay. So these are some occurrences where septic infarcts occur, because septic infarcts, it's characterized by secondary bacterial infection. It means there's already the primary bacterial infection. Then when there's a secondary bacterial infection of the necrotic tissue, we call it as septic infarcts. Okay, so septic infarcts, they are characterized by acute inflammation that converts the infarct to an abscess. And secondary bacterial infection of the infarct can result in gangrene, okay, for example in the intestine. So we'll go into gangrene in one of the topics under this circulatory disturbances part 2. Okay, so that's on infarction. Okay, so infarction, just to remind that it's a development of an area, okay, of localized necrosis in a tissue because of the sudden reduction of its blood supply. Okay, so next we'll continue under the topic of shock. So what is shock? So the definition of shock is actually a clinical state characterized by a generalized decrease in perfusion of tissues associated with decrease in effective cardiac output. So there are 4 causes of shock. The first one is called hypovolemia. It means that there's a decrease in blood volume. There's peripheral vasodilation, cardiogenic shock, and obstructive shock. So under the circulatory disturbances part 2, okay, on slide number 12, there's a picture. There's a picture that we could see that there's hypovolemia, heart failure, vasodilatation. So we could see, okay, so first we'll see when there's a myocardial or valvular disease going on, it can lead to heart failure. So heart failure will eventually lead to the decreased cardiac output and then causes hypoperfusion of tissue, which can cause the cell anoxia, and then it will lead to shock. And this cell anoxia, it causes hypovolemia, which is decrease in blood volume. It causes vasodilatation, and which all of these occurrence eventually it can lead to shock. And when shock occurs, it can cause a renal failure, lung failure, and also gastrointestinal lesions. So causes of shock, first one is hypovolemia, which is decrease in blood volume. And hypovolemia, it may due to hemorrhage or excessive fluid loss, which causes decreased blood, which then can cause decrease in blood volume. And hypovolemia, it may occur in diarrhea, vomiting, burns, dehydration, and also excessive sweating. So there's like a small picture in this slide number 13. The signs and symptoms of hypovolemia. So you could see that the person is actually like, it's like sweating. I mean, like maybe after going through some few runs. Okay, you could see that. So there's like lethargy, oliguria, flat neck veins, dry skin. I mean, those are some signs and symptoms of people that has decrease in blood volume, or we call it hypovolemia. So hypo means decrease, blood volume, hypovolemia. Okay, the second cause of shock. So just to remind that shock, it means that it's a decrease in perfusion of tissue, which is associated with decrease in cardiac output. Okay, so hypovolemia is one of the cause of shock. There's another one, which is the peripheral vasodilation. So peripheral vasodilation, it means that it's dilation of small vessels, which leads to pooling of blood in the peripheral vessels. Okay, and this peripheral vasodilation, it leads to reduction of the blood volume, that then causes the decrease in cardiac output. So there's a picture here in the slide on vasodilation. So we could see that there's the normal blood vessel, and when vasodilation occurs, the blood vessel is dilated. Okay, so when the blood vessel is dilated, there will be increased transport of oxygen, of nutrients, of glucose, and this will then decrease the blood pressure and also removal of the cellular waste products. So vasodilation, it may due to the action of metabolic, toxic humoral factors, neurogenic stimuli, or the spinal cord injury. And when neurogenic shock occurs, fainting is one of the common symptoms. So anaphylactic shock is also the same mechanism, but it is mediated by histamine, bradykinin, and leukotrienes from the degranulation of mast cells and also basophils. So this is for the peripheral vasodilation, which is one of the causes of shock. The third cause of shock is cardiogenic shock, which is resulted from the severe reduction of cardiac output due to cardiac disease. For example, the acute myocardial infarction, acute myocarditis, arrhythmias. So there's a small picture on this slide number 15, about cardiogenic shock. So cardiogenic shock is the inability of the heart to maintain the cardiac output, which is necessary to meet the body needs. And then extra strain on the heart causes decreased tissue perfusion. Okay, So the causes could be systolic dysfunction, diastolic dysfunction, arrhythmias, or structural problems. And the clinical symptoms that causes this cardiogenic shock is tachycardia, anxiety, increased preload, pulmonary congestion, decreased cardiac output, decreased blood pressure. So this is the cardiogenic shock. It means that it's the inability of the heart to maintain the cardiac output that is necessary to meet for our body needs. Okay, to meet up our body needs. So that is like shock to the cardiogenic shock to the cardio. How about, okay, the fourth cause for shock is obstructive shock. Obstructive shock, it means that it's caused by obstruction of blood flow in the heart or pulmonary artery. So that's why kita call obstructive shock. Okay. Because as we know, shock means that there's a decrease in the output of cardiac, kan shock to the decrease in the effective cardiac output, kan. So obstructive shock tu dia maksudnya dia caused by obstruction of blood flow in the heart or pulmonary artery. So for example, what happens kalau ada pulmonary embolism ataupun large left atrial thrombus that yang impact the mitral valve orifice dalam heart, benda-benda ni dia cause lah, it leads to the obstructive shock. The cause of the shock. So there's like a small picture here untuk obstructive, kan. It means that the blood flow in the heart or the great vessels is blocked. Kan. Nampak tak ada XX ni, XX ni maknanya ada berlakunya obstructive dekat heart. Okay. So kalau a person has a pulmonary embolism, it can lead to obstructive shock, kan. Kalau dia ada large left atrial thrombus, it can lead to obstructive shock. So the topic yang we learned in the circulatory disturbances one tadi, macam thrombosis, embolism semua. So which disturb our circulatory system. Benda ni semua disturbances to the circulatory system. So bila adanya thrombosis, embolism dan sebagainya ni, it can lead to further problems such as shock. One of it is shock, kan? Shock. So maknanya bila berlakunya disturbance, berlakunya congestion, berlakunya obstruction to the circulatory system, to the blood flow, to the body fluids in our body. So ini yang berlakunya, it can cause infarction, it can cause shock. Okay. So so that's why saya bahagikan kepada dua bahagian. So in this circulatory disturbances 2 adalah dia macam kesan-kesan daripada what happens from the disease in circulatory disturbances 1. Maknanya kalau pulmonary embolism, kan, dia boleh leads to obstructive shock, macam itulah. Okay, so itu adalah berkenaan dengan shock. Okay. So in my next video, I will continue on another 2 topics under the circulatory disturbances 2, which is gangrene dan juga edema. Okay, so see you guys after this.